So in the last shot I discussed the simple or basal media. In this shot I will be discussing the enriched media. So enriched media is formed when a basal medium is added with additional nutrients like blood, serum or egg. It is in addition to non-fastidious organisms, it is used for the demonstration of fastidious organisms. So examples include the blood agar. Blood agar is prepared by adding 5 to 10% of sheep blood to the molten agar at 45 degrees Celsius. It is most widely used medium. The blood agar also tests the hemolytic property of the bacteria, which may be either partial or alpha green hemolysis, like hemolysis. As blood agar contains the RBCs, the bacteria lyse the RBCs, producing the hemolysis. So if there is a partial hemolysis, we say it is alpha hemolysis, and when there is complete hemolysis of all the RBCs, we should say it is a beta hemolysis. Then comes the chocolate agar. Chocolate agar is a heated blood agar prepared by adding 5 to 10% of sheep blood to molten nutrient agar at 70 degrees Celsius. At this temperature, the RBCs will be lysed and the content of RBCs will be released, making the color of media to brown. In blood agar, RBCs are intact, but in chocolate agar, RBCs are lysed. For example, it supports the growth of highly fastidious bacteria like Haemophilus influenzae, which does not grow on blood agar, as chocolate agar is more nutritious than the blood agar. The third example is the Loeffler's serum slope. It contains a serum and used for the isolation of Corynebacterium diphtheriae. And fourth comes the blood culture media, used for isolating the microorganisms from blood. So blood culture media is an enriched media used for isolating the microorganisms from blood. So first comes the conventional blood culture media. It consists of the first one is monophasic medium, which contains the brain heart infusion broth, and the second one contains the biphasic medium. It is a liquid phase containing the brain heart infusion broth and a solid agar slope made up of brain heart infusion agar. The recovery of organisms in the blood is enhanced by mixing the blood in the broth periodically, and after 1 week we can see cultures formed. Then from this broth, subcultures are made onto the solid medias to detect, confirm the diagnosis. Here you can see that this one, it is the monophasic medium, the brain heart infusion broth, and this one is the biphasic medium, which I told you contained of a brain heart infusion broth plus brain heart infusion agar ka solid agar slope.